this basic idea is a superb idea. Means it is a very necessity, and there are so many women suffering at the middle age and beyond. And these kind of initiatives are really necessary. So I really congratulate Dr. Ameya and team. Dr. Ameya, you have to unmute yourself. Okay. Yeah.
Yeah. Can you have the previous slide, Richa? Sorry, I unmuted because I didn't want to disturb you while speaking, and then I couldn't unmute myself. Yes. Over to you, Dr. Manish.
Okay. So this is the great Dr. Martin Luther King, who said, "Injustice anywhere is a threat to justice everywhere." And when we talk about the gender equality in the society, and we really have achieved gender equality in most of the sections, but when it comes to sexuality, is it a fact? Means is the gender equality is a fact, or it is still we have to go ahead much longer? So regarding this, it is while the most of the men, they achieve orgasm, but it is said that hardly 29 to 35% of the women sometime in their lifetime experience the orgasm, and this is where the inequality is very gross. And we are going to learn how we can get aware about the sexuality.
Richa, can we please have the next slide?
So there are certain facts, irrespective of gender, whether you are a man or a woman, human sexual function is an essential component of life. It is not only for procreation, it is not only for reproduction, it is not only for creating children. It is very essential for the good quality of life, and sexual dysfunctions can result into reduced quality of life. Interestingly, sexual dysfunctions are more common in women as compared to men. But it is said, the fact is there are 24 FDA approved treatment for the male sexual dysfunction, while not a single treatment available to women for treating sexual dysfunction, which is a gross
that speaks a lot
difference.
About gender inequality.
Yes. So satisfactory sexual function creates a positive self-worth as well as a self-image. It is very important because we are already we all the time we have a taboo about this subject, and we are talking about the negative part of it. The sexual intercourse will result into this or that threat, that kind of. But the sexual pleasure is an integral part of well-being. Nobody talks about, but it is the fact. And concept of positive sexuality needs to be understood and promoted.
Next slide, please.
We have next slide. So now we are going to talk sexuality in menopause. So what is the need to talk about it? As we all know, day by day there is an improved healthcare and there is an improved life expectancy. Means earlier the illnesses used to take a large toll on life, but now with the improved life expectancy, it is said that 1/3 of the life the women are going to spend in their menopause. So this is a big time. It's like 25 to 30 years. And also there is a rising awareness about the sexuality, the changing mindset about the sexuality, because initially it was like once the couple become grandparent, then probably it's time to go for some tirtha yatra or that kind of our routine trends are. But now it is very well proved with different studies that like in SWAN study, it was conducted in US, 76% of the menopausal women reported sex in moderate to extremely important to them. While another study conducted in Australia, it says 56% of the women, they feel improvement in their sexual life even after menopause. So it is just about our cultural and religious orthodoxy. means it is not at all abnormal to continue having physical relationship or sexual activity even after menopause.
Yeah, I think
I'm sure it's
abnormal
such a
is the word.
yeah.
Abnormal is a very important word. Like, I think the idea of this being abnormal and what is normal is, so thank you for definitely bringing that up.
So unless
Uh-huh.
and until the person, irrespective of gender, a man or a woman, is fit and is willing, means there is no age bar or there is no limit to have continued sexual activity. This is the baseline message.
And I'm sure
So
if we have such studies in India, they're going to kind of come to the same conclusion as well as in US. And
yes.
yeah. So I think, like Dr.
So
Manish said, there are no FDA-approved treatments for uh, women for their sexual disorders. Yeah, so we could go to the next slide.
now the two treatment options have come, but they are not available in India, unfortunately, yet.
Hmm.
So as female sexual dysfunctions are not life-threatening, so they are frequently overlooked, they are neglected, ridiculed, criticized, they are kept off priority. Due to the embarrassment and hesitation, such complaints go unspoken and unexpressed. And women feel frustrated, depressed, and having poor self-confidence. And we are here to tell you all that there is nothing abnormal to have sexual desire or willingness for it as an abnormal thing. And in fact, whatever problems, means physical, physiological, or emotional problem, they can be dealt with the help of medical experts into the specific field. So when the sexual dysfunctions are there, it affects the quality of life, it affects the self-esteem, dignity, the happiness index, productivity at the personal, family, and professional front, the self-confidence, and also it is very relationship and bonding. Can we have next slide?
Next slide.
So there are three gross categories of the issues of sexual dysfunctions in the menopause. First is libido or desire. Means it's a frequent complaint that the desire इच्छा नहीं होती है. The desire has become very poor, or it is actually absent. It can be there. Second thing is orgasmic dysfunction. Now it is really a question how many people really, I mean women, they understand orgasm. Orgasm is it is the topmost pleasure during the sexual activity. In men, it is evident in the form of ejaculation. But in women, means it is very difficult to define that particular point. And the third category is the pain and penetration disorder. So we are going to talk on each of it one by one. So first of all, is it normal to have desire? So absolutely it is normal. Age is absolutely no limit for having sexual desire. Age-wise, the sexual desire can decrease as compared to the younger age, but even it can be normal as the younger age also. And sometimes a person can be totally disinterested into the sexual activity, and that is also normal. So only thing is by whatever mindset, if that is distressing, if you are thinking over it, why I don't have desire, or why my partner wants me to be active, but I don't feel like having sexual activity. So if this question is bothering you, then yes, you can get a medical help to search what can be the baseline reason for lack of desire, and certain the libido. So can we have next slide? So why the desire is poor? So first of all, in Indian setting, most of the, let's talk about majority, and I would say the religious mindset or the cultural orthodoxy, which we have been, listening since our childhood. Sex is really only for procreation, and even the first lady doctor of India, she was having a mindset, if husband is otherwise he is very good, then only at that moment whatever he does, let him do that. Anandibai Joshi means, this orthodoxy was there, but it is not true, and we have to really ask ourselves if we are stuck into that, or if we are, means nothing wrong into that, or I don't have any objection, but we have to ask ourselves, are we following that particular trends, that sex is seen, and uh, it should not be done now, means is it the age to perform sexual activity? So that can be very much first reason to have poor libido. Then with the now one message popped up. There are many messages for popping up. So after hysterectomy, if ovaries are also removed, then there is sudden decrease in the estrogen and testosterone. Estrogen is a female hormone. Testosterone is a male hormone, but it is also present in the women, and it is responsible for the libido, or the जिसको हम इच्छा बोल सकते हैं. So whenever there is a surgical menopause, the ovaries, whenever ovaries are removed, both the ovaries are removed, then there is very much possibility that libido also can go down. Then the relationship issue, the conflict with the partner, with the advancing years of marriage, certain issues are totally unresolved. And this can be the reason for poor libido, the divorce, some aversions, the partner is having smell of the teeth, or because of the diabetes or poor hygiene. These kind of things can be aversion factors. There can be extramarital affairs, and that can be the reason for turning off. Then lack of partner, that can be possible after the 40s or 50s. Then overall family dynamics, means how many members are there into in the family, and what privacy they are getting. Like 2 BHK flat, one flat is for the son and the daughter-in-law, or like that. One is for kids, and the elder parents, means they are assumed that they don't need any privacy. They are sleeping into the
In the hall, or yeah.
in hall, yeah. So in that case, they need to get time. They may go, somewhere, like it is not necessary only younger couple should go somewhere. Then the emotional stress, the financial stress, the health concerns, means most of the women, the mothers, they worry a lot. They will worry about their son, they will worry about their daughters, then they will worry about their uh, everything, means job of the son, financial status of the son, means what not, they can have worry about everything. So they need to limit their worries. They have to get out of the stress. Then the financial stress, if there is some earning lady, or if the husband, uh, when after the retirement, there can be really some financial challenges. Then the health concerns, diabetes, hypertension, cardiac issues, then orthopedic issues, or other some issues. They can be the reason for worry, and it can ultimately result into the poor libido. Then, as I spoke earlier, the religious and cultural orthodoxy. Then with the menopause, whatever atropic changes happens, atrophy is, thinning of the epithelium, just like the baby skin, it is very difficult to hold, versus a person who has crossed 80s or 90s, the skin is very thin. So in between, the thinning process, it is not sudden. The thinning process is a gradual process, and during that thinning, the intercourse can result into minute abrasions, and that can result into pain, irritation, and painful intercourse that we call medically as dyspareunia. There can be some orthopedic pain because of the knee joint pain, or a hip joint pain, or some stiffness with the joints. Then there can be issue with the poor self body image. the youth is not permanent. So with the changing body, some people can really get distressed about the way they look, and there can be solutions for it. Then the poor genital health, there is something called as prolapse, means there is a feeling of something is coming out of the vagina. The uterus is either the uterus is coming or the bladder is, it is forming some bulge. Some people leak on coughing or sneezing or while stepping down the steps. So that can be a distressing factor. Then overall psychological health, the emptiness syndrome. एकदम हरा भरा घर एंड लड़का लड़का लड़की सब चले गए. The daughter got married, the son he went abroad for some job perspective. So that is called an empty nest syndrome, and some depressions associated with, and something called as vasomotor symptoms. So whenever there is a menopause is approaching, for the first 2-3 years, there are tremendous symptoms like sudden night sweats, palpitation, and the reddening of the face, and the fearful feeling. So that can be distressing. Then lack of sleep. As the age advances, the sleep reduces. That is the law. Means a newborn will sleep for 20 hours. He or she will wake up just for feeding. While with the advancing age, the sleep definitely get reduces. So there are certain methods to get a good sleep. So lack of sleep can be a very important reason for lack of libido, because it causes overall lack of energy. Then sexual violence or sexual abuse, if unfortunately it is faced, and the sexual behavior and sexual problems of the partner. So certain medications, after 40s or 50s, some antihypertensive, some anti-diabetic, or some medicines to modify psychological symptoms, they can result into poor libido. And if there is nothing like that, then yes, sexuality education is necessary, because then whatever is remaining is the mindset issue. Can we proceed to next? Yeah. So this was regarding desire issues. Now there are orgasmic dysfunction. So orgasm is like the topmost pleasure point during the sexual activity. Now one important thing I would like to highlight here, the typical intercourse, which is called as missionary position, means the lady is sleeping and the partner is on the top. This is the routine position. This is called as missionary position. And for orgasm to be achieved in women, clitoral stimulation is very necessary. We are going to show the picture of clitoris. It is a knob-like structure just above the urethral opening. And the stimulation of that clitoris is very necessary to achieve the orgasm. Yeah, this is that picture. And the clitoris is not just tip, but it encircles the vaginal opening totally. So initially it used to be called as vaginal orgasms and clitoral orgasms, but nowadays we say that orgasm is orgasm, whichever way it is achieved, whether it is achieved with the penetrative intercourse, or it is achieved with the manual stimulation of the clitoris, it is a partner sex, or it is a masturbational practice or self-pleasure technique. The orgasm is orgasm, and the clitoral stimulation is most important into that. This needs to be understood. Can we have a previous slide? Yeah. So for having okay, fine. This okay. So the earlier slide was mentioning that intercourse happens in between two legs, but the orgasm happens in between 2 ears. There is a lot of meaning into that particular sentence, because orgasm is not genital stimulation or not just achieved by the genital intercourse. It is about the mindfulness, how much you are into that act. The typical joke we listen, like after some years of marriage, while performing the intercourse, the woman or the lady will suddenly tell her husband, our fan is so dirty, I will clean it next day. Means, you know, how much you are involved into that act that is very necessary to achieve the orgasm. So orgasmic platform gets built in with the desire, the willingness, the wanting, the romance, the love, a stress-free environment. It should be devoid of distraction. You know, the grandchildren are playing around, and you really lack the privacy. Quality of interpersonal relationship, the emotional intimacy, the other stress like financial or job or domestic, and overall marital satisfaction. Then is the partner is really respecting you, valuing the mutual needs, and the shame, guilt, and fear factor, and because of the orthodox upbringing and the turning off factors like smell, appearance, about the self as well as of the partner. So all these factors to be taken into the consideration when we are talking about achieving orgasm. Can we have next slide? Yeah. So this is clitoris. So this is a typical female sexual response cycle. There is a first there is a desire. Then with the desire, whenever the couple is indulged into the sexual activity, the excitement starts. In men, it is a hardening of the penis, while in women, it is the wetness and engorgement of the genital organs. And then the next thing is achieving orgasm. Now, one very important thing I would like to tell here, that average, I am talking about average. So averagely men achieve orgasm in 3 to 4 minutes, while women achieve orgasm in 11 minutes, and there is the disparity. So here you need to talk to the partner, or you have to go to the sex counselor. And most important thing that needs to be learned is to give break in between. You know, you have to ask your male partner to hold on in between, because once his orgasm is achieved, then the female partner is left without achieving the orgasm. So that is one important thing. So there are different models of female sexual response cycle, and accordingly the sexual dysfunctions are described. Yeah, can we have next slide? Then the pain penetration disorders. As with the menopause, the elasticity of the vaginal passage, the birth canal, it reduces. With the before menopause, the estrogen hormone makes it very elastic. Means what extent it can get stretched, it is 200 times, while during childbirth it can get stretched to 200 times of it normal and still come back to the totally normal size. But after menopause, these elastic fibers are very much reduced, and because of that the distensibility or stretchability is poor, and because of that it can result into painful intercourse. And there are certain treatments coming up like lasers or PRP treatment, means that can help into that. Then there is an issue of decreased lubrication. With the poor estrogen, the blood flow to the vaginal wall, it is very poor, and we say that the lubrication is because of the vaginal transudate or a vaginal sweating. It is because of, just like male organ, it is engorged with the blood during the sexual intercourse. Similarly, the female sexual organs also engorge with the blood, and because of that, the wetness is there. The oozing of the clear fluid, as well as some Bartholin gland is there. So Bartholin gland also, it shrinks in the size after the menopause, and that results into dryness, and probably use of good lubricants is very necessary. Otherwise, the sexual intercourse is going to be painful. Then easy infections, as the thickness means, you know, the vaginal wall thickness, it is like 5 to 6 layer epithelium, which becomes very thin during after the menopause or after the estrogen hormone is less, and that results into poor resistance of that particular organ, and that results into easy infection as well as easy abrasions. That's why a role of good lubrication is very, very necessary as compared to the premenopausal life. So lubricants, there are many lubricants. The lubric gel is one of the very simple lubricant, even the coconut oil or saliva, or we say a good foreplay can also result into good lubrication. Means, so now there is a question here: is it normal to feel sexual desire in advanced age? We already spoke about it. There is no age bar for it. Absolutely no age bar. Only we have to change our mindset, and it is absolutely as per our comfort. The like or dislike, the acceptance or non-acceptance is absolutely means it's a personal thing, and accordingly you can choose. Then you need to talk to your partner regarding your needs or your problems. It is a beautiful suggestion given that both the partners should write down the needs on the paper and just exchange the paper, and you will be surprised. There are so many things they are unsaid over so many years. It can be anything regarding sexual activity. Then lubrication has to be a important part after menopause because of the said factor, because of the thinned out vagina, because of the poor natural secretions of Bartholin gland, means the wetness gland. Then increase the intimacy. It is again an interpersonal factor. Means it is necessary. It means it cannot be a mechanical act. There has to be some emotional connect into that, and then the sex will be pleasurable or enjoyable, or let's say satisfying, or it's an enrichment experience. Means a life enrichment experience. That is what it is said. And as I mentioned, you can still go out on some vacation. Not only youngsters or teenagers are supposed to go to Lonavala, Khandala, or wherever. So for getting privacy, for getting a good romantic environment, still it can happen to get the solutions. So there is a concept of negative sexuality and a positive sexuality. Now, since childhood, we are being taught, stay away from the sex. It is dirty, it is sinful, and it causes complications like pregnancy complications like abortions, ectopic pregnancy, the molar pregnancy, and then the sterilization operation, the everything, the maternal mortality, and the children. Means all government programs, they are focusing the contraception, the condoms and pills and copper tea, everything is taught. It is necessary, definitely, but this is all creating fears in the mind of public that sex is something which is very dangerous thing. And but in the Western culture, they don't hesitate to have sexual intercourse because they are taught how to be comfortable with the contraceptive devices or with their sexuality. So there is something called as positive sexual rights. Means every person, irrespective of gender, irrespective of age, is having sexual rights. Means if they want to achieve sexual gratification, and it's absolutely their personal right. There is a wide-ranging positive and meaningful impact of the sexuality on the health and well-being of the people, and there is a right for every person to pursue a satisfying, safe, and pleasurable sex life. We need to understand importance of fully integrating sexuality and sexual health within such national program of country, but it is very difficult because even we talk about the sexual health education in the school, there is a big no from the politicians and government, but it is necessary. It can avoid many complications, and similarly, it is necessary to understand. Means it is for every person to understand about the sexuality related issues, and sexuality is to be counted as positive life enhancement approach, and its importance into the relationship and bonding. Without a satisfied sexual activity, uh, means rarely there can be good bonding. Means it can be a very good way to develop the intimacy or a bonding with the partner. for the both the sexes or both the genders. And also it creates a good satisfying sexual activity, creates a positive self-worth and positive self-image and acceptance about the one's own sexuality. Means it is, I know we are still in that orthodox era, but I can say that the self-pleasure technique or engaging with to the same sex or a same gender person, it is not considered as abnormal by the science. Only thing is, whenever we are engaged into a sexual activity with some other person, it must be taken care that the sexual right of that person should not be violated. Okay, so sexual health is not about just treating the sexual dysfunction. That, you know, there is dryness, there is pain, there is orgasmic dysfunction. Means the sexual health should not be restricted to that, but rather it should be considered for restoring or rejuvenating or even enhancing the pleasure element in the sex, because there are many benefits of the good sex. The first of all is getting good sleep. Then it is very good for the cardiac health as well as your blood pressure. Then it is considered as one of the good exercise. Then it is good for the genital health, because it is said that it is use it or lose it. So, you know, your fractured limb, have you ever noticed if we have a cast and we remove the cast after, you know, 1.5 month, and you see there is a significant difference in the size of the muscles, because whenever the things are not used, they undergo atrophy. So whenever the people who are regularly indulge into the sexual activity, they seldom develop the sexual dysfunction. This is the fact. So bigger the gap in between two sexual intercourse, like, you know, once in 6 months, the problems like dryness or abrasions or pain will be more. And regular sexual activity will always help to maintain the elasticity, to maintain the blood flow of that organ. Then we have next slide. So I think anything else, Dr. Ameya, we should discuss, or we should?
I think we can take the questions, Dr. Manish, because we've got a lot of questions. People have asked quite a lot of questions. So maybe we could.
Yeah, before taking the questions, I would just like to thank you, Dr. Manish, for taking us through this amazing presentation. It's very important. I think a lot of things we spoke about are very, very, very important, and we don't even know, like, just the diagram that you showed. I'm sure, like, so many of us don't even know our own self. And another thing that I think is very important, and I would like to ask you around it, is that how do we get out of this fear of being judged? You know, one of the reasons why we don't talk about it or don't share about it with our friends or with a professional is that we are always being, like, you know, we always as women have this fear of being judged.
Correct.
Because of the conditioning that we've always had, right? Like that we are, for us it's only about producing and reproduction. So how do we get away from that thing and not shy from asking for help, or just discussing it with our partners or friends?
So here I would say you need to be really confident and bold enough to express yourself. Learn to say no whenever you wish to say no, and express your wish clearly, and be confident. Means it is said that since after 2000, it is said that the sex revolution is happening in the world. Okay, even the WHO mentioned in 2007 first time the importance of sexual health in women beyond reproductive age. Means they are not only for procreate. So this is a gradual change which is happening in the society, and with the webinar we are conducting or the all other kind of such webinars and knowledge, the people are gaining courage, to speak up for themselves, for own right. And I think
Right.
that's a very gradual journey, but it's happening and it will happen.
Yeah. Thank you so much. So I think to sum it up, we've realized that, that's why Elda has taken up this step of a sexual wellness program, where we realize that women grapple with changes in their body, changes in their emotion and sex drive as they approach menopause, and shifting hormones and multiple priorities, and basically overall stress also could hamper arousal, which leads to changes that make you uninterested or uncomfortable with sex. It's not always related to your physical changes, but also your mental and emotional changes. But all of this is absolutely normal. And Elda definitely wants to make you feel better and help you out, because there are solutions to these problems. And that is why we have something called Elda's sexual wellness program, where it's going to be a session with Dr. Manish, where we try to help you through a detailed assessment to understand what your issue is, and there will be a counseling to address this issue. It's a completely non-judgmental platform. We keep your information private, and I'm going to share the link to the wellness program over here. You can check it out, book a consultation with us, understand more about it. And
So
you
first of
can
all, about being non-judgmental, it is absolutely our right, means how much we are allowing the other person to cross the boundary. Okay. It is about understanding the self-worth and means respecting ourselves. Then be firm on our decision. That can help.
Correct.
Yeah. Thank you so much. I've shared the link over here. You all can go check this wellness program, sexual wellness program, and we've done this only because we know that so many of us suffer through this in silence, and we definitely want to do this. I'll take the questions from the beginning. Let me just
I
go
think the
through
first
this.
question was about diabetes and sexual desire.
Yes.
One question was there. First question: how to improve the sexual health? So as we discussed, for having good sexual activity, it is important to be in good health. So the what we say, the typical improved lifestyle means daily walk, daily exercise, a good sleep, proper food timing, and optimizing the weight or blood pressure or the cardiac health. It is very essential. And when everything is good, then probably for having the good sexual health, the overall general health should be good, your and your partners. Yeah. Then the diabetic.
So someone asked, that her husband is diabetic and he thinks we're old to have sexual activities. So is it really diabetes person who loses interest, or?
No, diabetes per se, it is absolutely as we discussed. First of all, what happens that whenever diabetes is basically affects the blood vessels. Okay, that's why the kidneys or retina or the fingertips, the gangrene and everything, the complication happen because it affects the blood vessels. So it is always like that. The erection in men is a vascular event. It is because of the turgid blood accumulated inside the penis that makes the penis hard. So it may happen that because of the diabetic vasculopathy or the affection of the blood vessels, the blood cannot result into, the blood flow is not enough to have good erections. And it itself can be a reason for poor libido in that person. So there can be treatment for that particular dysfunction if there are erectile dysfunction, number one. And if there is a problem of mindset, abhi to hamare grandchildren hai, why we should be engaging into these particular activities, then, and one partner is interested, then they need to meet a sexual counselor. Discuss the
Right.
issues of both people, and then the solution can be there.
Right. Someone's asked that they are just 38 and she doesn't have any desire, any sexual desire. Is that normal?
So, no, means we have to really go at the root cause of this particular. Means, was there desire initially and now it is not there? Are there any relationship issues? Are there any conflicts, stress factors? Many people have lost their jobs in COVID, or they have lost their keen in the COVID time. So there can be any reason. Means we have to actually think about it. And also there is something called as premature menopause or premature ovarian failure, where the ovaries, they totally stop functioning much before than expected. The average menopausal age is said to be like 47 to 52. Sometimes it can extend up to 57 also. But nowadays with the many things, mostly smoking is there, or some unknown factors in the environment, that they are resulting into the menopause at a very early age. And she has to undergo certain evaluation to rule out if she is facing any premature menopause issue. That is one. And other, with the counseling session, we can find out what is the actual baseline reason for that. Is there any stress regarding children's education? The child is not performing well into the school. There can be anything. Even Sushant Singh Rajput, the sudden demise has caused shock to many people, and they don't understand it, the subconsciously. Even the change of government shocks many people. Means there can be anything.
Anything.
Right.
I
There have been a lot of questions.
On hysterectomy.
Yeah, correct. Is it okay to have sex after that, and how comfortable is it, and things like that?
Yeah, absolutely. Hysterectomy is not a contraindication for sexual activity. After hysterectomy, the vaginal passage is intact, so there is no issue to have intercourse. If the ovaries are also removed with the hysterectomy, then she will need some assistance in terms of hormonal treatment, or some local therapies like lubrications and all that, depending upon means tailored to her specific genital health.
Another question that is very common is that people who remove their uterus and ovaries, does that also play a role in having no desire, or
That's what.
in
So
changes?
removal of uterus has no role as far as desire is concerned. But whenever ovaries are removed, then the estrogen and testosterone, means even the androgens, the male hormones, they are produced from the ovaries, and they are actually required for the desire more than the estrogen. So even after menopause, the ovaries, they stop producing estrogen, but they do produce androgens. And it gets converted into testosterone, and that's why the desire is still there in the menopause. And menopause is not an exception. The testosterone effect is having the hair growth on the upper lip or on the chin, and that hormone is very much available into the postmenopausal women with the intact ovaries. But the ovaries are removed, means uterus doesn't matter, but the ovaries are removed, then yes, the libido can be poor. The desire can be
And
poor.
yeah, and also someone's asked, does removing fallopian tube or epilepsy can be a cause?
No. Fallopian tubes, it is said that the ovarian cancer actually originates from the fallopian tube. So whenever there is a hysterectomy is done, so every time the fallopian tubes are generally removed, and it has nothing to do with the poor libido or even having active sexual life.
Okay.
I think the
Someone's
next
asking, yeah, someone's asking about role playing. Is it always necessary, and is it
Normal.
because her husband wants to do it and she doesn't want to? So is it always absolutely necessary, or is this something related to menopause that she has no desire for it?
No desire for role play or no desire for
Yes.
sex?
No
Okay.
desire for role play.
Okay. So, it is called as spicing up into the sexual activity. Means the monotonous sexual life can really result into the poor response in terms of erection or in terms of lubrication. So these kind of things many couple they use, and if both are comfortable, then they can be really useful to have this kind of practices. But one should not force uh, against wish to follow whatever the desires of others. Like, it is as per the personal comfort level, and they simultaneously, as a couple, they need to meet a counselor. Meeting counselor is not a big thing. He will, he is the referee who will settle down the issues in between you two.
Right. Doctor, also, are there some foods that increase estrogen levels or increase the libido? Like, does food play a role in this?
Well, it is said so, but there are no means very clear cut what we say, like soybean food. They have estrogen like chemicals. So we always say to the menopausal women to just get a soya recipe book and every day eat some soybean element into that. But it is means slightly overrated. Means the HRT, the hormone replacement therapy, the estrogen treatment is the gold standard. If it is not contraindicated, then it is the best. And if it is not indicated, means if some risk factor is there to use the estrogen, then some certain other drugs can be used. But the foods, yes, they can improve, but they are not that effective. If like some Viagra can maintain the erection in men. Okay. But if some food, onion or garlic, that also it is called as aphrodisiac.
Aphrodisiac.
So,
Yeah.
but it will not have effect like Viagra. So that is why I said it's overrated. Yeah, it is definitely said, or I also have read a lot about it. But Sidhi baat no bakwas, to be the estrogen replacement therapy is the main thing.
Is it so? Someone has said that they get an orgasm while masturbating, but not through sexual intercourse. So, is that normal? What should they do?
Yes, it is normal. Rather, means it is a very, what do we say, that it is a truth that, as I mentioned before, most of the men, they achieve orgasm in 3 to 4 minutes, while the females, women's may take 11 minutes, 10 to 11 minutes to reach to the orgasm. So, and in the typical Indian type of or a traditional intercourse, where whenever the clitoris is not stimulated, only the penile intercourse, the to and fro movement of the penis, that is not really going to achieve the orgasm every time, or very less time. The clitoral stimulation, it is manual or oral with the partner or with the self. Means that is very necessary to achieve orgasm, and that is why if the orgasm is experienced during the masturbation but not during intercourse, it can be totally a fact. It can be totally normal, and there is no problem into that.
Take one last question. Doctor, can you expand a little on andropause? Is that a thing?
Yeah, I was going to ask that. Interesting.
How to handle menopause and andropause in men and women like at the same time, and is andropause even a thing? Because it's not much is spoken about it, even lesser than menopause. So is that a real thing, or
So as the menopause is a very drastic it is a complete stoppage of estrogen synthesis in women. The testosterone synthesis in the men, it is a very gradual decline if they are not suffering any pathology. So it decides the overall energy levels, the vigor and vitality. Means this is what we say. So it's a gradual process. So with the advancing age, it gradually declines. That's why even very elder person, you know, in 75 or 80, he still marries and he still can have a child, you know. So, but it is also depending upon the mindset. Means I have seen newly married couple, means, you know, Socrates, uh, the great philosopher, he has written something, means that particular patient told me that if you are having intercourse more than once in a month, then you should dig your cover earliest. And that was really a shocking sentence or a shocking concept. Means many people, means they have written about it, and that mindset causes people, you know, abhi bacche hai, abhi grandchildren hai, abhi I have to focus on my business. It is about the interest, how much romance or how much, you know, interest that particular person is having. I think that is probably the better analysis rather than a hormonal andropause. Again, I will say the mindset.
Right. Thank you so much. Unfortunately, we have only this much time. If any of you have any more questions, please reach out to us on our community, on our social media, or anywhere else. I've shared the link of the sexual wellness program that we have. You can go there. You can see what all is available. Again, we are a judgment free space, and if you want to know anything, absolutely ask anything, please reach out to us on this WhatsApp number, and our care managers will understand your needs, even if it is related to just menopause. And yeah, thank you so much for the session, Dr. Manish and Dr. Ameya, and this was great. I'm also sharing the Facebook community that we have. You all can go there, ask the questions there. Our experts are available there also. Please uh, watch out for more webinars that we're going to keep every 2 weeks. We have one webinar ranging from nutrition to yoga to menopause. And once again, thank you so much, all of you, for joining, and see you all soon again. Bye bye.
Thank you.
Thank you so much.